and speak loudly. Hi, today is February 13th, 2019. This is Dorothea. Hi, Dorothea.
Hi. Hello.
Dorothea entered the office in mid-September of 2018, about 4.5 months ago. And Dorothea came in with some fairly serious left knee complaints. Is that correct, Dorothea?
Yes, I had a torn meniscus and a lot of pain, and I'd been in pain the whole summer.
Yes. And so, Dorothea, you brought your MRI in when I saw you that initial visit. Do you remember, do you mind if I just share the findings of your MRI from August of last year?
Not at all. Please do.
So here is the MRI scan for Dorothea, and medial pain after gardening. And I'd like to just read this briefly. It says, meniscus intermediate signal mucoid change through the substance of the meniscus diffusely. So what that means is that the meniscus was changing in its texture, becoming more mucoid or less taut and tight and strong diffusely up to the intermediate grade irregular undersurface and free margin degenerative appearing tearing through the posterior horn and body with the sparing of the anterior horn and root. So what that's saying is at the undersurface of that meniscus there was degenerative appearing changes with tearing. And then the articular cartilage, which is the cartilage that has to glide freely without friction on the bony surface of the bone, it says uniform grade 2 to nearly grade 3 thinning of the articular cartilage. It goes to grade 4. This is grade 2 to nearly grade 3 at the anterior medial condyle, as well as hazy T2 marrow edema, so swelling at the outer margin of the plateau, greater than the condyle. And then below it says the patellofemoral compartment, that's her kneecap, was heterogeneous signal and grade 2 thinning on the cartilage at her kneecap with grade 3 fissuring on the median ridge and the medial facet, the inside portion of her kneecap. And this is more pronounced on the under or inferior surface. And then it says a prominent grade 4 articular cartilage loss, which means the cartilage had degenerated on her kneecap in the central trochlea and underlying sclerosis, meaning increased density of the bone because of the roughening and the irritation with swelling and cysts. Anterior to posterior distance of that damaged area was 1 centimeter and width of nearly the full trochlea. So, how difficult, Dorothea, was just doing normal life and normal activities and walking, and how bad was it and how much was it interfering with your life?
A lot. Like I said, I was in pain the entire summer. And then when I started coming here, it was still in a lot of pain. It hurt to go up and down stairs. It hurt a lot to go in, step in and out of my car. I had to step in and out certain ways. I had to be constantly watching my knee, where I stepped and how I stepped. I couldn't turn easily. I had to turn more carefully than ever before. I couldn't kneel on it. I couldn't turn over in bed very easily. It was very hard to turn over in bed because I couldn't use my foot to turn over.
Because that caused pain in your knee, correct?
It hurt my knee to use my foot to turn over in bed. I couldn't lie on my left side. I could only lie on my right side or on my back. Sometimes I couldn't even lie on my right side. It would hurt the knee. And especially if I laid on my left side, it would really hurt the knee. So sleeping was hard because I couldn't move around at all. That was like the worst of it.
So then what did
I couldn't get if I was sitting on the ground, I couldn't get up.
So can you tell me how has it changed?
A lot. It's changed really a lot. The pain is pretty much gone. I hardly ever feel any pain. Maybe if I accidentally tweak it in some way, I might get a little bit of pain, but it goes away right away. I was telling Dr. Sievely that I could be in a music class with my grandson and sit on the floor and get up and down with him 2 or 3 times, which I never could do before. And I was worried about it, but I was like, oh no, now what's going to happen? But I was fine. It felt a little tender after that hour of getting up and down 3 or 4 times, but that was all. It was just a little tender, and it went away. And
it went away quickly.
Quickly. There was nothing the next day. maybe just a little teeny bit of swelling, if at all. But now I can turn over in bed without a problem. I'm careful, but I can do that. That's totally new.
How about steps?
I can sleep on any side I want. I can go up and down steps. I can exercise. I can do all the exercises that I've been asked to do, and I can work on
pain-free,
pain-free, totally pain-free. I can work on my exercise machines at home, and that's not a problem. Yeah, so it's much, much, much better.
So how difficult was it going through the treatment process?
Not difficult at all, except for sometimes when painful manipulations, sometimes those were hard, but most of the time it was fine. And it was a little hard for me because I live far, and so I couldn't come 3 times a week. I only came twice a week. But even with just twice a week, I still made this great progress.
How far were you coming, Dorothea?
50 minutes.
50 minutes. So
yeah.
Dorothea was driving 50 minutes to get her. She wanted to spare her knee. She did not want surgery or replacement.
I didn't want to have surgery, yeah. I didn't want to be 6 weeks in a cast. That's what the doctor had said. I'd be 6 weeks in a cast, 2 weeks on crutches. And
who knows how long trying to rehab it.
Yeah,
yeah.
Right, exactly.
So, Dorothea, do you have any advice for future people who might be suffering, wondering, is this a reasonable option? What advice would you have for them?
I think it's a great option, an important option to avoid the surgery and all the recovery from that and whatever damage that might do to it. And also the thing I thought was really important, I didn't realize that it wasn't just the torn meniscus. That was the result of the problem. That wasn't really the problem. The problem was the degeneration of the cartilage. And I didn't know that. But when I thought about it, I'd realized, well, you know what? I have been a little sore going up and down stairs in both knees. So I'm really happy to restore the cartilage in my knee and avoid knee replacement or something like that. I think that's a great idea to do that. And I know that there aren't very many physicians around the country that understand the importance of restoring the cartilage, but there are a few, and they're starting to realize that repairing a meniscus tear with surgery is not necessarily the best option. This is a much better option.
And basically what I asked you to do, treatment consisted of doing the Whitey patches in conjunction with LC Balancer, and then a nutritional protocol to stimulate stem cell activation and repair of the cartilage.
Yeah.
And that was just a matter of swallowing pills and wearing a patch, right? I mean, that wasn't difficult,
no,
right?
It wasn't hard at all.
And then in combination, we did laser therapy and we did ultrasound therapy, and you've been doing platform vibration therapy at home with your own unit, and beamer therapy at home, doing your own. Or no, that was here, right?
The beamer therapy was here, but I have a laser light.
Yes, laser light. And so there were a variety of pulsed electromagnetic field therapy. So there was a variety of things that we did to stimulate and activate the repair of that cartilage. And you can see, based on Dorothea's MRI, that it was highly damaged. So, Dorothea, super proud of you. You worked hard and you've gotten the benefit. And do I have your permission to share your story with doctors, students, or patients anywhere?
Yes, you do.
Any restrictions on that?
No, none at all.
Dorothea, I'm excited, even when we do this re-MRI, should be interesting, and that hopefully will be in the not far distant future, and we'll see what it tells us beyond what we already know.
Yeah, I'm looking forward to seeing the progress.
Great job. Thank you.
You're welcome. Thank you.